Harvest is the largest food bank in the province of Manitoba. A couple of years ago, I was having lunch with a group of women who were volunteers and also clients of the food bank. One woman began to tell a story, and the story got longer and more complicated in the telling, and finally she stopped herself and laughed and blamed her confusion on a change in her medication. What happened next shouldn't have surprised me, but it did. People began comparing their experiences with pharmaceuticals. Some were reaching into knapsacks and bags and pulling out pill bottles to compare. And I looked around and I soon realized that I was the only person at that table without a prescription for an antidepressant. That shouldn't have surprised me because we medicate poverty. We medicate the anger and despair of parents who can't feed their kids without recourse to a food bank. And we can do better. Basic income is a guarantee that everybody will have the resources they need to lead a modest but dignified life. It doesn't replace necessary social services like additional supports for people with disabilities or health care, but it does ensure that everybody has enough cash to put food on the table, a roof over their heads, and clothes on their back. Now, you might be asking yourself why we need a new program like basic income. After all, every province in Canada has a program in place that's designed specifically to ensure that people with no other source of income have enough money to meet their basic needs. Depending on where you live, it might be called welfare or social assistance or income assistance. Why isn't that good enough? If you've never applied to such a program, you may imagine that application is a straightforward process. In fact, every one of these programs is a complex collection of different benefits and allowances that makes it very difficult to determine how much you're entitled to receive. These programs can also be something of a trap. In many provinces, extended health care, things like dental care and pharmacare, are tied to the receipt of income assistance. If you have children or if you have a disability, it can be a very risky proposition to accept a job opportunity that comes along if it means that you have to give up access to these other programs. These are also programs of last resort. What that means in practice is that if, for example, you're owed child support, you'll be required to pursue that through the courts, whether you want any contact with a former partner or not. If you receive a gift from a family member, even something as small as a gift of groceries or a few dollars to help with the rent, your benefit will be cut on a dollar-for-dollar basis. If you've worked in the past and you expect one day to get a pension from the Canada Pension Plan, you'll be required to apply for that pension at age 60, even though the financial penalty of applying at age 60 is such that it virtually guarantees that you'll be living in poverty for the rest of your life. If after all of that, you qualify for support under these provincial programs, you'll receive a benefit that's well below the poverty line anywhere in the country. The greatest limitation of these programs, though, is that none of them are intended to be standalone programs. They're part of a vast web of different programs and policies put in place by different levels of government, every one of them intending to send cash to families with low incomes. Some of them are offered by the federal government, by the provincial government, by municipalities. All have different application processes, eligibility requirements, and regulations. We force people at the very worst times in their lives to navigate a complex bureaucracy in order to access the benefits they need to live. We can do better. The labor market's changed dramatically over the past 2 decades. Young people entering the workforce today have very different opportunities than their parents and their grandparents had. Even before the pandemic, 30% of working Canadians were in precarious jobs. That is, jobs with low pay, volatile earnings, and no security. And yet all of the programs we've put in place to assist low-wage workers are based on the kinds of jobs that used to exist. If you lose a precarious job and apply for employment insurance, you'll very often find you haven't worked enough hours to qualify. Or if you do qualify, you'll receive a benefit that's too low to meet your basic needs. We can do better. A basic income can fill the gaps between temporary programs. It can act as a supplement to low wages. It can do what employment insurance can't do. Basic income supports healthy families and healthy communities. The pandemic showed us how quickly an infectious disease can move through a neighborhood that's characterized by overcrowded housing and too many workers in frontline, low-wage jobs. The mental health effects of living with poverty in a high-income country like Canada are fairly obvious. But our health is determined in so many ways by the circumstances within which we live. My first serious introduction to basic income happened when I was working at the Health Sciences Centre in Winnipeg. This is an inner-city teaching hospital, and it doesn't take very long in that kind of a setting to recognize that we're using our emergency departments, our operating theaters, and our clinics to treat the consequences of poverty. I went in search of data associated with an old experiment that I knew took place in Manitoba in the mid-1970s called MINCOME. I wondered whether people who received a basic income were healthier than their counterparts who didn't. For a period of 3 years, a group of families in Manitoba received a basic income. And the data showed that people who received a basic income were 8.5% less likely to be hospitalized than similar people with similar incomes living in similar kinds of families and communities who did not receive a basic income. 8.5%. Our healthcare system isn't the only social program we have that deals with the consequences of poverty. 80% of women who are incarcerated are in prison for poverty-related crimes. 80%. How different would this world be if we spent a little bit of money on prevention rather than waiting for crises to occur and using social programs to deal with the consequences of those crises? Some people worried about the unintended consequences of a basic income. After all, why would anybody work if they can receive money for nothing from a basic income? We have experimental evidence from all over the world that suggests that basic income doesn't discourage work. During the MINCOME project, most people who were working when the project was introduced continued to work after basic income was put in place. It made no difference to their work effort. Two groups of people did work less. The first were new mothers. New mothers in the mid-70s could anticipate a maternity leave of 4 weeks when they gave birth, and many new mothers decided to use some of the MINCOME stipend in order to buy themselves longer parental leaves. We've subsequently learned that babies benefit, families benefit, mothers benefit, all of society benefits when parents spend longer with newborn infants. The other group of people who work less are precisely the people that everybody worries about, young single men. Young single men cut their work hours really dramatically. So I went in search of some of those young single men a few years ago, men like Eric, whose widowed mother received MINCOME support while he was in high school. And Eric told me that boys from families like his were under a fair amount of family pressure to become self-supporting as soon as they could. The norm was that they would turn 16, they'd leave high school, they'd get a job, sometimes a seasonal job in agriculture or a job in manufacturing, and the limited family money could go to support younger brothers and sisters. When MINCOME came along, some of the parents, including Eric's mother, encouraged their sons to stay in school just a little bit longer. And so Eric became part of a lucky cohort of boys who finished high school, who otherwise wouldn't have. In many cases, they were the first in their families to have finished high school. Eric is now a college professor. The opportunities available to somebody who might have finished high school by giving up a few hours working in the mid-1970s are dramatic. But given all of this, the question that sits in everybody's mind is, can we afford it? Basic income sounds like a wonderful policy, but is this something our country can afford when we have so many other demands on taxpayer dollars? That was precisely the question that was put to the Parliamentary Budget Office. How much would it cost to offer a basic income to all Canadians who needed it? The economists at the Parliamentary Budget Office crunched the numbers and they came up with an eye-watering $85 billion a year. It might cost $85 billion a year to offer basic income, but they said, but We're already spending $85 billion a year and more on all these other programs that are designed to transfer cash to people with low incomes. Provincial income assistance, welfare, provincial social assistance, refundable and non-refundable tax credits, deductions, a whole range of programs that are put in place precisely to do that. What they said would happen if we took the money we're already spending and spent it smarter. We could cut poverty by 49%. Now think about that for a minute. We could cut the poverty rate in half with no increases in taxes, no new taxes, no cuts to important social programs like supports for people with disabilities. All of these programs stay in place and poverty falls by half. It's time for a basic income. We can afford it. Our friends, our families, our neighbors deserve it. And a healthy society demands it. Thank you very much.